Thank you very much. I will read one question that I received through SMS from DPA, German news agency, our friend Christian Ulrich, who is asking for Dr. Tedros, but maybe also for Mike, what are the biggest lessons the world can learn from Ebola outbreak in Congo in fighting the epidemic?
It's difficult. Sometimes we over-extrapolate from one event to the other, and sometimes we don't learn enough lessons and we don't adapt enough. I think what we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons. But the lessons I've learned after so many Ebola outbreaks in my career are: be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past. Deaths, rather than trying to, when we can say 10,000 deaths and sounds like a lot, and then other people say, well, you know, people die of other things too. But take one look at what's happening in some health systems around the world. Look at the intensive care units completely overwhelmed, the doctors and nurses utterly exhausted. This is not normal. This isn't just a bad flu season. These are health systems that are collapsing under the pressure of too many cases. This is not normal. This is not just a little bit worse than we're used to. This is tough for systems, and therefore trying to use the absolute number of deaths as a measure of the overall impact of this outbreak is probably not the right term to use. But certainly, when we say 1% overall case fatality, it's a number. But when I would say to you that in certain situations, particularly in the over 70s, in a number of situations, the case fatality, the clinical case fatality, the case fatality in those people admitted to hospital is up to 1 in 5 for people over the age of 70 years of age. That's a really, really serious outcome for anyone being admitted with COVID-19. And equally, when we look at people in intensive care, if you look at in Italy at the moment, 2 out of 3 people in intensive care in Italy are under the age of 70. And in fact, 12% of people in intensive care in Italy are under the age of 50. So again, let's look not just at deaths, let's look at severity, let's look at the impact this is having in society.